The Systems for Improved Access to Pharmaceuticals and Services program continues the USAID legacy of improving pharmaceutical management for better health outcomes, especially in the areas of HIV/AIDS, malaria and tuberculosis. To give us an update on this system, we are joined by Mr. Evan Sagwa from the Management Sciences for Health. He is the country director. Good morning, sir, and welcome to Good Morning Namibia.
Good morning, and thank you for having me on the program.
I was asking you earlier around the acronym SIAPS.
Yeah.
Can you give us the details of what it stands for and what the mandate of your institution is within this regard?
Yeah, I know it's many people find it a little bit difficult to explain and understand the acronym. It's long, but simply it's about making sure that essential medicines are available to the people who need them most. So in full, SIAPS means or stands for Systems for Improved Access to Pharmaceuticals and Services. So stronger pharmaceutical systems enables better patient care, better patient treatment, better patient services.
So typically, what would be some of the a challenge that we would face, and then how would your intervention address that type of challenge in an improved and more efficient manner?
Thank you. I'll start off by quickly saying that SIAPS as a project is a USAID project, and it's funded through the US President's Emergency Fund for AIDS Relief, or PEPFAR. So we are in the implementing agent. Management Sciences for Health is the implementing agent. And when we come into a country to provide support, we adopt a holistic view. We use the WHO, the World Health Organization systems approach to analyzing the system and then understanding where we can improve. So this systematic approach uses or looks at different dimensions. For example, human resources available to provide the services. Do we have strong and robust information systems? Is the financing system able to make available the funds that are needed to run pharmaceutical services in the country? Do we have services accessible to the people who need them? And most importantly, essential commodities like medicines available. So that's the approach that we used when we started operations in Namibia, and we identified quite a number of things. Top was the issue of an availability of suitably qualified pharmaceutical human resources. So we've worked with the stakeholders, including the University of Namibia, the Ministry of Health National Training Center, to scale up the training of pharmaceutical human resources. So the School of Pharmacy at UNAM was established through our support, and the Ministry of Health National Training Systems program for pharmacists was scaled up through our intervention. So I'm happy to say that on that piece, which is a crucial piece of health system, pharmaceutical system strengthening, Namibia is now on a solid footing. There are other aspects that we can talk more, but briefly I can also mention the aspect of making sure that information systems are strong so that managers and decision makers make decisions that are evidence-based, that are based on factual information.
But obviously, it's good to have interventions that try to enhance the health, of the people. But what type of impact has your intervention created thus far in terms of maybe access, in terms of improved health outcomes? Can we talk about specific impact?
Yes, I'll also want to take this opportunity to just show some of the things that I'm talking about. For example, one essential thing that is needed for making sure that essential medicines are available in the country is to have an essential medicines list. This is like the shopping list that the Namibian government uses to procure medicines for the country. So for the viewers, I'm just displaying one of them. This is the current edition of the Namibia Medicines Essential List. This is the list that governs the availability, the procurement and the availing of medicines throughout all hospitals, health centers and clinics in the country. And I'll say at this moment, the availability of medicines, especially for HIV, has been great, hovering above 85% in the recent past. And prior, it was hovering around 90% plus. That's just one example. Another quick example is the standard treatment guidelines This is a booklet that is used by clinicians to guide doctors, nurses on how to best treat patients on a particular condition, and this booklet we helped to develop. So these are just some of the examples that I want to share with viewers on the direct benefits and impact of the work that we are doing.
Obviously, the minister, when he came into office in the past 2 years, really tackled the issue around the cost when it comes to pharmaceuticals. He traveled the region and he came back and he said, we're paying about 3 to 5 times as much for the consumption of drugs, which obviously then directly affects the quantity of the access to the number of drugs. Do you also address such a key factor?
Yes, as a key technical support partner to the Ministry of Health, we are working closely with the Ministry of Health. We are working closely with the Office of the Minister to identify opportunities to make medicines procurement processes to be value for money. What it means is that we should procure medicines at a price that we as a country can afford and at a price that is competitive. So we are approaching using this, we are using several approaches. For example, avoiding dealing with intermediaries and going directly to the source, the primary supplier. For example, if it's a manufacturer, advising the ministry on how best to go to a manufacturer so that you can acquire and procure medicines at a lower price than if you are using intermediaries. Another quick example is using what we call pooled mechanisms. Pooled mechanism is where a country, for example, Namibia, and another neighboring country, for example, can come together, combine their needs so that they can benefit from economies of scale when they go to procure in the international market. So I'm happy to say that these are happening there at advanced stages, and in a short while, Namibia will accrue the benefits of these interventions.
Okay. Obviously, you spoke specifically around HIV/AIDS medication, which in the past, people say that you might have access to the ARVs or the ARTs, but a lot of the times it's not complemented with the necessary other health kind of nutritional factors.
Yes.
So how do you address instances where people have access, but they don't necessarily have the nutritional backing to ensure that the medication is working effectively?
That is an important point, and it speaks to an element that we call adherence to medication. Patients, especially people who are living with HIV, those ones who are taking antiretroviral medicines, and also for TB treatment, they find it really difficult when they take medicines on an empty stomach. They feel sick. Sometimes they feel like they want to vomit and stuff like that. So although we don't directly deal with issues of nutrition, but we work in close collaboration with partners within the ministry and other partners outside of the ministry who tackle the issue of nutrition. It's a wider issue. It's something that needs other line ministries to address to ensure that Namibians and patients have access, sustainable access to food.
Okay.
Yep.
Just as you're closing, obviously remark, what would you say are the key areas that we need to really strengthen in the way that we are processing this process of ensuring that people have access to pharmaceuticals?
Yes, we need to make sure that patients, especially in the rural areas, the hard to reach areas, have access to essential pharmaceutical services, because there's no point in having medicines available at the district headquarters and a patient who's living 200 or so kilometers away cannot reach those medicines. So we are working closely with the Ministry of Health of decentralizing and making medicines closer to the community, available through community channels, and as well as also exploring avenues to partner with the private sector, because you can get in a particular setting, the public health facility is several kilometers away, but there's a private doctor close by. There's a private clinic close by. So how do we partner with such stakeholders to make sure that patients gain access to the medication? Then another important thing is when you are on medication, especially when you are on long-term treatment like HIV, diabetes, hypertension, it's important to make sure that you are adhering to the medication as per the doctor's instructions. So I think we have an opportunity. For example, here I just want to share a simple flip chart that we've developed and designed to educate patients on the importance of sticking to antiretroviral medicines, and also for them to know the impact of when you swallow the medicine. What does it mean? What does it do in your body? What does it do to the virus? So we believe that we need to continue educating patients so that they know the importance of them playing the role that they need to play so that they can benefit from the treatment.
Those your last words?
I would say that this is Namibia is on a very good course in attaining the control of the HIV epidemic. More patients, more people are being put on treatment, and therefore systems need to be strengthened to make sure that patients enjoy good health and they can lead productive life. And that will translate into a healthier, productive nation.
Okay, thank you very much for your inputs. I think those were really great. Well, Namibia, there you have it, Mr. Evan Sagwa, who is the Country Director for the Management Sciences for Health, talking about the institution's key role in supporting the Ministry of Health and Social Services in ensuring that pharmaceuticals reach all corners of the country. They want to decentralize it and make sure that the medicine is as close as it can be to you. I think it's a great initiative and a great effort that's been made. We'll be back with more. This is Gem, and it's the first half. Do stay tuned.